Hey everybody, Dr. Gibbz back again, and today we're going to be talking about teeth. Alright, so let's talk about teeth. Now when we are born with all 20 of our baby teeth in our mouth. They just haven't peeked through the gums yet. Yep, all 20 of them. Now when they get ready to come through the gums, they will appear and feel like these nubs right there. And if you look slightly over to the right, you'll see there's another nub right there. A little bit of a closer view and you'll see this tiny slit where the first baby tooth is going to peek through. And here's a picture of those two baby teeth in the mouth. This is a tooth chart showing you when we expect to see all 20 of those baby teeth coming into the mouth and when we expect them to fall out of the mouth. Now let's take a moment to orient ourselves. You have the left side and you have the right side. And this is as if you are looking into a child's mouth. You have the top and you have the bottom. Now, your baby teeth are actually given letters rather than numbers like your adult teeth. So the top teeth are A through J and the bottom teeth are K through T. Let's take a moment to talk about this word, eruption. Eruption just means when are these teeth expected to come into the mouth? And as we saw in the previous picture, O and P are typically the first ones that we expect to see in the mouth, around 6 to 10 months. Now the same two teeth up on top, E and F, come in around 8 to 12 months. This is the perfect time to take your child, and it's actually the recommended time to take your child to your local dental office to establish dental care. Now when your child reaches around 3 years of age, that is when they should have all 20 of their baby teeth in their mouth. If they don't, go to your local dental office and have them do a dental exam and see if your child is developing normally. Shedding. Shedding just means this is when we expect these teeth to come out of the mouth. In other words, this is when the tooth fairy is going to come by and pay a visit. Around 6 to 7 years is when O and P are expected to come out, getting ready for those permanent adult teeth to come in. That's around the same time E and F come out as well. And it's around the same time that you'll start seeing those cute little pictures where kids can drink through a straw without having to actually open their mouth. Now let's talk about our adult teeth. This is a very similar tooth chart to the one we saw with the 20 baby teeth, except there are a lot more teeth here. Now let's quickly orient ourselves again. We got the right side and the left side, and this is as if you are looking into an adult person's mouth. You have the top, and here's the bottom. Now as I mentioned earlier, your adult teeth are given numbers rather than letters like your baby teeth. So on the top we have numbers 1 through 16, and on the bottom we have numbers 17 through 32. Now here's that word erupt again. This is when we expect to see these adult teeth coming into the mouth, and typically the first one is your first molar, around 6 to 7 years of age. Shortly after that, or around the same time, you will see these first bottom teeth here coming in around 6 to 7 as well. And here's a picture of that first permanent molar right there. That's tooth number 30. These guys over here are your baby teeth. Here's R, S, and here's T. Whoa, this looks really crazy, but it's perfectly normal. Now, let's take a moment to orient ourselves. You have our primary teeth, better known as our baby teeth, K through T. And these guys are our adult teeth. Now, as our adult teeth begin to come in other words, erupt into the mouth, you should start seeing these baby teeth get nice and loose. So in this image, you should start seeing O and P getting nice and loose and eventually falling out on their own. But if for some reason they don't fall out on their own and they're loose, feel free to wiggle them out yourself just to create some room for your adult teeth. Now this is also an important time as these adult teeth are starting to come in to watch your child and make sure that they are not developing any poor dental habits. One of those poor dental habits is thumb sucking. Yes, it is very, very cute, but it can cause several dental issues. One of those dental issues is open bite. As you can see here in the image, the child is biting on his back teeth, but the front teeth never touch. So as your child is developing, if they keep a thumb-sucking habit, those top front teeth are going to be pushed forward, and the bottom front teeth are going to be pushed back, causing an open bite. Now, if you look at that big red circle, that's your tongue. This can also encourage another habit that isn't really great. It's called a tongue thrust, and this is where your tongue slides forward every time you swallow and pushes against those front teeth. And this is what a tongue thrust looks like. The sooner you catch it, the easier it becomes to treat. I personally didn't notice that I had this habit until I was an adult, and I corrected it using braces. Now let's see if we can help answer some of your wisdom teeth questions. This is our adult tooth chart, and let's see if we can orient ourselves one more time. Here's the top, and here is the bottom. Now typically you have 4 wisdom teeth, 2 on the top, number 1 and number 16, and you have 2 on the bottom, number 17 and number 32. Your wisdom teeth tend to come in or erupt around 17 to 21 years of age. Some of you may not have any wisdom teeth. Some of you may have all 4, or any number in between. These are some of the different ways that your wisdom teeth may develop. Now some people have their wisdom teeth taken out because they're either causing them pain as they are coming into the mouth, or they are just simply too difficult to keep clean because they're really far back there. Now I want you to pay attention to partial eruption. This is where the tooth attempts to come out, but it is locked or stuck underneath that tooth in front of it. Now here's what that looks like. You have your wisdom tooth coming in, but it's lodged and stuck behind that tooth in front of it. Now your gums or your tissue is still covering that tooth because it hasn't come all the way through. And as you eat and bite your teeth together, your teeth on the top start biting down on that tissue and start causing it to get really irritated. This is another reason why some people may choose to have their wisdom teeth taken out.